As a rhinoplasty surgeon, I see three large groups of patients. Number one, I see patients, young ladies between the age of about 15 and 20 years of age. They realize that there's something a little bit imbalanced about their nose and they may want to change it. Normally, they're trying to make their nose smaller. Second group of people who we see are boys, girls, men, women between the ages of about 20 and 50 who realize that there's something slightly aesthetically imbalanced with their nose. Third group are people who are aging a little bit, people over the ages of 50, 55, and we notice that things gravitationally elongate, may come a little bit bigger, and again, we image them, examine them, make sure there's no breathing issues, and we try to achieve something that will be ideally pleasing to them and put them into better balance. That's what we're here for. All we're really doing is putting the nose into better balance with the rest of the face, and in most circumstances, it's a win-win for those patients. When we've selected patients who are thinking of having a rhinoplasty procedure performed, we want to make absolutely certain that their airway is okay. And there are many people who perform rhinoplasty surgery who are not that concerned about airway, but I think it's very critical to a successful outcome. There's two main ways that we do rhinoplasty surgery. 30 or 40 years ago, we were doing all of this surgery in what we call a closed format. We're making cuts inside the nose, totally internal, no scars on the outside. And then, starting about 25 years ago, some great surgeons thought, well, maybe we should open the nose up, a so-called open rhinoplasty. We make a little cut on the lower part of the nose, open things up. What I've found over the years, because I've probably done about 15,000 rhinoplasty procedures, I perform a closed technique probably about 70% of the time, and I'll open the nose up maybe 30% of the time. But my goals are trying to avoid an open approach if I can, because the patients heal faster, there's less scarring, and they don't have a visible scar. Typically, if we're changing the shape of the nose, they will have a splint on their nose for a week. They'll have a little pack inside their nose for probably one day that they will pull out themselves. They come in and see us at about a week. We take the splint off, and when the splint comes off, three things are going to bother them. One thing is that the nasal tip will look swollen. Secondly, depending upon how they slept before, if they slept on the right side of their nose or face the evening before I see them, the nose may look a little bit to the right, and likewise to the left. And thirdly, they may have a few pimples on the nose, but most patients can go back to work at about 10 days following surgery. But honestly, for a thin-skinned individual, it takes about a year for the nose to heal enough to say you're done. The goal as a rhinoplasty surgeon is really to turn a patient's face to match their nose. We do have patients who come in who will say, I want to look like this movie star. And in the long run, it probably won't fly very well in light of the fact that it may not be aesthetic balance for their face. That's what we're here for, achieving aesthetic balance. And a lot of the time, that does not involve idolizing a Hollywood or an athletic person. And so I think that's very important. If you're thinking about having a rhinoplasty, really, all you need to do is to call the Younger Facial Surgery Center, talk to one of our assistants. They'll book you to come in, consultation, and you can go from there.